We are on the brink of a cardiovascular catastrophe almost because of our lifestyle, because of our diet, because of our genes. If you take the city of Karachi alone, the average number of heart attacks per year is probably one of the top 5 in the world. And there are multiple factors that go into it. You know, there was just this news on Express Tribune today about Pakistan being named the 9th most obese country in the world, especially in Karachi. You see a lot of obesity now. You know, just go to any school and you'll see a lot of kids that are visibly overweight. We frequently treat patients in their 30s who come in with heart attacks. So there's a reason for all of that, and it's our lifestyle and diet that's the biggest reason. The kind of food that people have access to is not very healthy. I mean, I love Pakistani food, don't get me wrong, but it is very heavily based on things that are not good for you. So it's emphasis on meat, emphasis on fried foods, a lot of oil, a lot of fats, and it doesn't just affect people who are maybe in their 30s or 40s or older, it affects their children as well. So kids develop the same habits that their parents do. You know, they watch you eating something, the way you're eating, what you're eating, that's what kids pick up. Heart disease is a spectrum where you go from very minimal cholesterol deposition in the arteries to where you get a moderate obstruction which causes angina to where you get a complete heart attack. What you have initially is you have increased inflammation in the body that causes cholesterol to form within the arteries to the heart until it reaches a point where it's causing an obstruction in the blood flow. And that obstruction and reduced blood flow causes symptoms of angina, which is chest pain. Generally, angina, if it's stable, you'll hear of patients and uncles and aunties who walk up a flight of stairs, they say, oh, you know, mere chest mein dard ho raha hai. They stop and it goes away. That's considered as chronic stable angina, that somebody has this disease and they're getting medications, hopefully getting medications for it. They get symptoms and it goes away when they rest. There's also unstable angina, in which you are just sitting, not doing anything, or with minimal exertion, you get a new onset of symptoms of chest pain, which means that there's rapid progression of the blockage because there's a clot either already formed or it's forming. What it means medically is that somebody has reduced blood flow to the heart because of a clot in one of the arteries that supply blood to the heart, causing chest pain and shortness of breath. And if it's not aborted with the correct therapy, then you can have serious consequences, permanent damage to the heart, and a lot of patients can actually die from it. Stress really affects your whole body, especially your heart, in a huge number of ways. Sudden severe stress causes something called broken heart syndrome, where the sudden surge of stress response hormones can instantaneously depress the heart function and cause something like a heart attack. So all those movies that you've seen, old movies where, you know, some father or mother gets bad news, clutches the chest and drops down dead, are actually based on reality. It does happen. Chronic prolonged stress in one's life, it clearly has a correlation with heart disease as well. It's not a given that somebody who has a stressful life will have a heart attack. But when you look at patients who've had heart attacks, a lot of them have a lot of stress in their lives. People who tend to deal with stress better tend to evolve habits where they dissipate some of the stress in their life through exercise, through other meaningful hobbies and whatnot, tend to live healthier lives and better lives than people who are unable to do that. There are many tools that can be used. They have to be individualized based on a patient's risk factors, their symptoms, their age, and what their probability of having heart disease is, which include a history and exam, blood tests, which include, you know, the cholesterol levels, their sugar levels, an ECG, Sometimes we'll do a stress test. There are CT scans and ultimately invasive tests like angiography that can be done to diagnose somebody who may or may not have heart disease. I think there's two kinds of patients in Pakistan. One are the sort of the ostrich kind who don't want to know what's going on. The other kind is who are hyper aware of what's going on, and they'll get tests done every 3 months. You know, the same test getting done every 3 months. The right way is probably somewhere down the middle. If you're in your late 30s, 40, whether you're male or female, you should get an annual physical with a primary care physician or a general physician, family physician. And that should involve getting your complete blood picture done, getting your cholesterol checked, being screened for diabetes, being screened for thyroid disease, getting your liver function test done, a chest x-ray and an ECG. Obviously, if something comes up on that, then the follow-up may be more frequent, but otherwise once a year should be sufficient. Up until women reach the age when they hit menopause, they are somewhat protected from heart disease. However, right after that point, they rapidly catch up with the male counterparts. As much as it is a problem in males, the sedentary lifestyle and the poor dietary habits in Pakistan are even more so for women. Part of it is lack of access to any other sort of entertainment, right? When you go out, it revolves around food. Even if you go out to watch a movie, you know, there's a server bringing you food there, and the food is not healthy. And women, I think, culturally have more of a challenge to access to sports and activities than men do. Technology has a huge impact in our field. Just from imaging alone, you know, we are able to image the heart so much better than what we were able to do even 10 years ago. You know, with 3D reconstruction these days, you can pretty much reconstruct the entire inside of the patient's body and know exactly what lies where. One of the things that I'm involved in is working with a 3D printer. We can actually image the heart through a CT scan or an MRI, and then use the 3D printer to create a model and look at that problem from different ways. Artificial intelligence is another space where there are huge advances, and I think that's going to be the biggest game changer in healthcare. Our problem is that we have a huge population with huge healthcare challenges and not enough manpower to be able to meet those challenges. And I think some of those gaps can be fulfilled with automation and technology where you have trained health workers with either iPads or smartphones with apps that they can use to diagnose problems at the point of care and provide solutions there as well. So I think unfortunately we're not where we need to be in terms of research productivity, considering our population and considering the amount of the wealth of talent that we have. You know, Pakistan is one of the few countries where we graduate more doctors than we do nurses. Usually the ratio is the reverse in other countries. When they go abroad to the United Kingdom or USA, they do really well. So we have the IQ to do research, to publish it. I think we lack a proper infrastructure and we lack emphasis on it as part of our training. The World Health Organization for the next 5 years has called non-communicable diseases its top priority, which includes heart disease, high blood pressure, strokes, diabetes. And so these are the problems that plague our society as well. And we should be at the forefront of looking into these problems, finding innovative solutions and applying them, and the rest of the world should be learning from us. There are pockets of exemplary researchers and academicians who are productive. You can look at Aga Khan, you can look at the Indus Health System, they're doing some fantastic work in terms of public health. There's certain organizations in Punjab and KPK that are doing it as well, but I think it's not enough. More needs to be done. We as a nation grow up in being taught how to survive because one, there's so many of us in a very small country. Two, the resources are limited. And three, the competition is tough, right? Everybody's out to do the best that they can. And to be honest, when you're in that sort of survival mode, you tend to cut corners. Medicine is no different from anything else. We've all had to deal with situations in which something was done which could have been done better. The thing we have to watch out for is that are we doing the best job that we could be doing at any given moment? If everybody does what they're supposed to do and does the best job that they can do, then the ethics will be fine.